NTEP is very important, because NTEP can be a part of a long questions of TB. What is National Tuberculosis Elimination Program? What is DOTS? What are the parts? And this is very much asked in Viva, this topic. Approach of a TB and what is latent TB, how you diagnose latent TB. Mantu is now obsolete. Now it's an era of TB Gold PCR, quantiferon TB Gold. The latent TB is diagnosed by quantiferon TB Gold. Mantu is now not recommended at all. So, how we diagnose latent TB, how we approach to a cases of TB, that is very important. Just basic 2 to 3 questions and NTEP. That's it. That's why I focused in only NTEP program, and rest of the programs you just heard about the name. That's it. I think so. You don't have to remember at all rest of the programs, but focus on NTEP. NTEP is important. Okay. So first, the NTEP is not the name before when it was launched. It was started in 1962 as the National Tuberculosis Program. In revised in 1997, it was revamped into revised RNTCP, Revised National Tuberculosis Program, in 1997. So when we have studied, we studied RNTCP based on DOTS strategy. What is DOTS? I will discuss. And again it's renamed in 2020 and officially named NTEP, National Tuberculosis Elimination Program, to reflect the government goal to eliminate TB by 2025. That is not possible because lack of strategical deficit in this program. We will discuss all those things. So, what are the goals and objective? Elimination of TB in India by 2025, reduce TB incidence to less than 44 per 1 lakh populations, reduce TB mortality 3 per 1 lakh populations, universal access to quality TB diagnosis and treatment, integrations with private sectors and digital tracking of all TB cases. So, these are all the goals. The first goal will not achieve definitely, because TB will not eliminated by 2025. Still now very much cases are alive and very much new cases has been detected. So, rest of the targets will know after this year if the goal will be achieved or not. And what are the key strategies of the component? First is a DOTS. DOTS is a direct observed treatment short course. First, the TB drugs has been given direct to the patient's daily basis. Patient has to come the clinic and they have to take it. They have to come on weekly, and there is in a kit, they have to take it weekly thrice regime kind of things when we have studied. But now then it's changed to daily dose. Now they have been given this 1 month therapy and their phone numbers has been taken. They have supplied some foods, aids. So this is all about DOTS. And previously direct observed mean you have to swallow the medicines in front of the health worker. That's why it's named direct observed treatment. But now the 1 month therapy has been probably given and it is monitored. So concentrate on NTEP. Treatment is supervised to ensure adherence. Suppose someone, when given that health worker, they have been allocated patients. যে আমার আন্ডারে এতগুলো পেশেন্ট থাকছে, আমার সেটা দায়িত্ব সে ওষুধগুলো খাচ্ছে কিনা ঠিক করে সেটা জানা, সে এসে টেস্টটা করলো কিনা. So these are all the short term objectives has been given to the dedicated health worker. That's why now that this directly observed treatment has been little bit revised and it is provided free of cost. The test is also free of cost. This is about DOTS first part, strategy, direct observed treatment short course. Nikshay Ecosystem. Nikshay Ecosystem is been introduced in NTEP. What is Nikshay Ecosystem? Every TB region basis, every TB patients has to be reported. You can't purchase a TB medicines from a routine any outside pharmacy. TB medicines is not available. TB medicines only restricted to certain certain centers, and it is available in government centers only, and few private centers, and if some private practitioners want to start, yes they can, but their name should be registered in the portal as a TB treating physician. Otherwise, he or she, any physician can't prescribe ATD, anti-tubercular drug. I have been diagnosed many cases, but I have to end of the prescriptions, I have to write, refer to real nearest sub-center to start ATD. Okay. And to diagnose TB, previous mode and what we have did in our practical rooms previously, it was been what? Acid fast bacilli only, routine microscopy. But now GeneXpert has been introduced. Why? Why GeneXpert is been having emphasized nowadays? দুটো কারণ, কে বলবে? আমি এফবি দেখেও কি করছি, হ্যাঁ সরি তিনটে কারণ আছে। This is a very important question. Why GeneXpert PCR has been introduced and emphasized now in NTEP? Every TB patients who have been started drugs must have that report. Why? Right, first is drug resistance. PCR, by PCR we can detect rifampicin and isoniazid resistance. This is the basic two drugs. If it's sensitive, we can assume all the pan drugs are sensitive. We are not testing all the drugs by GeneXpert PCR. GeneXpert PCR is a machine name, it is a company name, like Xerox. Xerox is a company, it is not a methodology. Methodology is CBNAT. Okay, CBNAT means nested PCR, cartridge based nested PCR. This is a very important question and frequently come. Why this we are heading to PCR? Why it is important? Frequently asked, and it will be definitely come if any questions related to TB. And in India, every prof there will be a question of TB. NTEP introduced GeneXpert PCR mandatory because of the three reasons. Why? Sputum AFB, what any AFB, acid fast bacilli, can initially confirm diagnosed. Okay, fine. This patient having a tuberculosis positive, but which tuberculosis? Is it a mycobacterium tuberculosis or it is a atypical mycobacteria? Is it a mycobacterium bovis? Because all can be tested positive by 20% sulfuric acid. But when you are doing PCR, GeneXpert PCR or CBNAT, it's been showed what? Dedicatedly mycobacterium tuberculosis positive. That's it. There is no speculations. By sputum FB positive, you have been a speculations. It might be this. Chances of mycobacterium tuberculosis is high, but it is not that confirmatory. Confirmatory test is GeneXpert PCR. Okay. Next, specificity. Mycobacterium tuberculosis diagnosed by normal ZN stain by sputum microscopy. It is not that high sensitive. Why? Human error is possible. You have to see 100 fields, then you can say okay fine, this is in a TB negative. If technicians say only 10 field, what? If there is a very minute load, then what? So PCR is a automatized test and it is very much sensitive. Very low bacilloid can diagnose what? TB. And lastly, resistance strain, because the drug resistance is evolving. Many patients has been positive as drug resistance TB. So initially we have to know the status of the drug resistance. Is the rifampicin ionized sensitive or not? So these are the three major indications. Okay, why we are doing PCR, an advantage over sputum microscopy. Got my point? Because, and what is the, if you say what is the gold standard diagnostic test of TB, that is TB culture. Only 5 bacilli you can diagnostic. So this is a Nikshay Poshan drug logistic drug management and Nikshay Sampark toll-free TB helpline, where you can get any informations. Public-private partnerships, involvement of private healthcare provider. So if you wanna start TB medicines, so you have to enlist your name as a TB physicians to the Nikshay portal. Of TB case from private sector is mandatory. That's why what happened previously, someone is suspecting TB, they start ATD. But now government said, okay, you have a definitely proof and you have to notify whatever your reasons behind it. And incentives under schemes like Nikshay Poshan Yojana. If you diagnose a case, notify the case, you will be rewarded. Everything is all about money. Free diagnostic service, all the CVNAT, TrueNAT we have discussed is a GeneXpert PCR, all are in free of cost. Sputum microscopy, we have discussed it, what is the advantage over the TrueNAT and CVNAT. TrueNAT is the same machine. Another machine name GeneXpert PCR is a company, TrueNAT is another company. Culture and drug sensitivity testing, chest access PCR. So all the aids under TB is a free of cost. The medicine, initial diagnostic, if you have been tested drug resistant TB, further culture, line probe assay, each and everything is in free under this scheme. And Nikshay Poshan Yojana launched in 2018, 500 per month direct benefit transfer to the TB patient for nutritional supports. Every TB patient will get 500 rupees per month, but these poor people doesn't know that, and this money will go on, paid via Aadhaar linked bank accounts. Drug resistant TB management, dedicated TB centers, treatment with second line anti-TB drugs and use of bedaquiline and delamandid. These are the two new drugs has been introduced for drug resistant TB, and this is very much kept sacred for the drug resistant TB. You can't get anywhere, not in private, nowhere. You can't get these two medicines. All MDR TB cases are tested for line probe assay and whole genome sequencing pilot basis. So MDR TB cases, for if you have been tested positive rifampicin and isoniazid, then all the drugs has been tested. Their profile has been tested by line probe assay. TB preventive therapy for household contacts for all active TB patients, mainly isoniazid based regimes. If someone has been positive TB, So their household has been also monitored and observed. TB Free India campaign, Gram Panchayat and district level certifications declaring areas as TB free after meeting criteria, 80% reductions in TB incidence and 100% case notification and zero catastrophic costs. So these are the free service under NTEP services, diagnostics, treatment, financial aid, follow-up, counseling and transport reimbursement. These are the all included in TB under NTEP program. So TB notification, what are the progress for 2023-24? TB notification, more than 24 lakhs cases reported annually. Private sector contributions more than 35%. Nikshay Poshan Yojana coverage more or less 90% of the received benefits, and treatment success rate 85% for the drug sensitive TB. But there is some challenges. What are the challenges? Under reporting from private sector, still now drug resistant TB burdens are now increasing. Everywhere that drug resistance has been increasing. Stigma and misinformation is still there. Migrant and urban slum populations hard to track. And lastly, that pandemic also disrupt the services. So this is all about NTEP. Rest of the programs you just heard about the name, nothing so much, that's it. But prepare a short note about NTEP. And mainly TB focus on three parts. First is the diagnostics or algorithm of TB. There is a very good algorithm in Shastri, and you have to know what is the advantage of the GeneXpert PCR over sputum microscopy. You have to know the latent TB, what is quantiferon TB gold, what is atypical microbacterium. Atypical microbacteria is very commonly tagged questions in sputum TB microscopy, and lastly in TB questions, and lastly NTEP. What are the key components of NTEP? Okay. So now we just fast forward all those programs. AIDS control program launched in 1992 and it is by NACO. Now in AIDS you have to know one thing, HIV is very important, and diagnostic algorithm. Diagnostic algorithm of AIDS and what are the opportunistic infection of AIDS. These two are very important. If you want to read two questions, just read two things in AIDS. What are the diagnostic algorithm? There is a very good charts in Shastri, and you have to know what is the opportunistic infections. That's it. National Vector-Borne Program, there is lots of vector control program, and malaria and dengue, chikungunya, filaria, kala-azar, JE, integrated vector control, rapid diagnostic tests, larva source management and mass drug administrations. These are the key components. And one thing, malaria is very important and dengue. These two are very important. In parasitology, you have to know protozoa. Malaria is very important. Diagnostic algorithm of malaria. What are the types of malaria? These are the millions times repeated questions, and a life cycle. These three, just it. That's why I am saying PUIK, because some questions has been never been changed. The TB, malaria, dengue, there will be no such tweaks on that topics. So that's why I have said first go with the PYQ. You will get all those questions. Malaria, you have to just, if you want to say, sir, what are the suggestions of malaria? I learn three things. What are the types of malaria, life cycle of malaria, diagnostics. That's it. And if you know the pathophysiology of malaria, good enough. That is being also asked. Okay. Dengue is the same. What are the types of dengue? Pathophysiology of dengue. How you diagnose dengue. See, if you go with microbiological aspect, you have to know the laboratory diagnosis of everyone. It will be asked. It's all about diagnostics. Sometimes you must be asked, you can be asked by pathophysiology, but the diagnostic will be definitely asked. So, never let off diagnostics. IDSP Integrated Disease Surveillance Program launched in 2004, detect response of outbreak early. National Viral Hepatitis Control Program, this is very successful program right now, and many centers has been given the tests, all the serology test has been run in free of cost, and also the medicines also has been provided in free of cost, and also their RNA and viral load, these can also be run by free of cost. So, everything has run now free of cost. Universal immunizations program, we all know, we are all taking immunizations. This is also has been delivered by free of cost. Measles, rubella, diphtheria, tetanus, pertussis, hepatitis B, all are under this. National Leprosy Elimination Eradications Program, 1993, the goal zero disability in children, early detections for in leprosy. Pulse Polio Immunizations Program, 1995, launched. Polio free in 2004, achievement, current focus, maintaining the surveillance. National Rabies Control Program for bite prevention, post exposure prophylaxis has been given in free of cost in every hospitals. National Program for Antimicrobial Resistance Containment. So, this is very important and has been introduced and hardly followed in India. This is very important because by 2050 globally highest mortality will be single cause will be drug resistance by 2050. And what we are doing right now, একটু গলা খুশখুশ করলো আগে একটা azithromycin খেয়ে নিলাম, we purchase azithrol, we purchase clavam, যে কাশলো দেখ জিজ্ঞাসা কর সে অ্যান্টিবায়োটিক খেয়ে নিয়েছে. So, this is we commonly done because of the 90% of the, I have told many times in my classes that all the ARI, acute respiratory infections, has been made by virus. Okay. So, promote rational use of antimicrobial surveillance and infection prevention control. Other related initiatives, GeneXpert Yojana, Ayushman Bharat, National Digital Health Mission for real time of digital, and COVID-19 National Response Plan for vaccinations. So, these are the summary of all the programs. First is the NTEP, then NACP, but NACO is very important, HIV, NBDCP. So, two program is very important, NTEP and NACO. NACO is important in which respect? Because the questions will come as per NACO guideline. HIV or AIDS, what is AIDS? What is HIV? AIDS is a syndrome, HIV is a virus, and what is the diagnostic algorithm by NACO guideline or NACP guideline, whatever. So, that is why is important, but NTEP as a whole, as a component, important. Rest of the things you just heard today, but that is not important for your exam purpose. Okay. So, it is all about, and see, this is immunizations. I think this is not at all important for you. Okay. So, last class, thank you so much. If you have any doubts, you can ask me. You all, I think all have my numbers and Ninish WhatsApp number, and go through the systematic PYQ first and go through the books, any books, whatever you like, whatever you comfortable, any books, then go for semester questions. So, this is how you approach. Make sure you can be very confident over what? Theory part, but that will be checked outside. In practical part, you will be definitely told what to read, what are the things, what are the tables, how the things has been given. I think that has been told definitely, and that will be told, no issue, but make sure this prof as a preliminary of your this semester is a preliminary of your prof. So, just make sure you can at least read once